Good morning, dear students. Today I am going to deal a new topic comes under respiratory system. As we all know, collection of pus in an organ or in a tissue, we call it as abscess. But in case of collection of pus in the pleural space, we call it as empyema. Collection of pus in the pleural space, we call it as empyema. Today I am going to deal the topic empyema. Dear students, at the end of the class, you will gain knowledge regarding the definition of empyema, etiological factors, clinical features, diagnostic measures as well as management of empyema, especially medical, nursing and surgical management of empyema. Now we can see the definition of empyema. An empyema is an accumulation of thick purulent fluid within the pleural space, often with fibrin development and loculated. Loculated means walled off, area where infection is located. Coming to the next definition, as S.N. Chung, he says empyema is defined as collection of pus inside the pleural cavity leading to compression of lung. In the picture we can see this is the lung abscess, collection of pus in the lung tissue, that is inside the lung parenchyma, but the outer layer covering of the layer, that is the pleural cavity, we can see collection of pus, that is called empyema. It compresses the lung tissue. We can see the etiological factors of empyema. Mainly it is divided into traumatic and non-traumatic. Traumatic and non-traumatic. The traumatic factors are penetrating chest injury with superadded infection. In case of road traffic accident or any penetrating injury, the infectious organisms will enter into the pleural space. Second one, it is iatrogenic. Iatrogenic means we will be introducing the microorganism into the pleural cavity, mainly in case of any thoracic surgery following pleural aspiration or intercostal tube drainage. In case of non-traumatic etiological factors, any diseases that affects the lungs, mainly pneumonia, tuberculosis, lung abscess, bronchiectasis and mediastinitis. Other reasons are osteomyelitis of ribs or vertebrae. Osteomyelitis means infection of the bones. That is mainly in case of ribs it is affected, it may leads to empyema. Then extrathoracic sepsis like rupture of subphrenic or liver abscess, that also leads to empyema. These are the etiological factors of empyema. Mainly we can divide the etiological factors into traumatic and non-traumatic. In traumatic injuries, mainly penetrating chest injury, iatrogenic means because we will be introducing the microorganism into the pleural space, mainly in case of any diagnostic or therapeutic measures like lung surgery, pleural aspiration or intercostal chest tube drainage. Non-traumatic, that means any diseases that affects the lung tissue, mainly pneumonia, tuberculosis, lung abscess, bronchiectasis and mediastinitis. Other cases are osteomyelitis, extrathoracic sepsis like rupture of subphrenic or liver abscess. These are the etiological factors of empyema. Coming to the pathophysiology of empyema, as we all know, there is less amount of fluid in the pleural space, mainly it is very thin and the leukocytes count is very less. But in case of empyema, these etiological factors causes inflammatory changes in the pleural space. Mainly because of that, the inflammatory process progresses to a fibropurulent stage. Finally, it encloses the lung tissue within a thick exudative membrane. It compresses the lung tissue. That is called loculated empyema. Coming to the clinical features, Actually, the patient will be very sick in case of empyema as any other lung conditions like pneumonia. The patient will have fever, night sweat, weight loss, cough, dyspnea, anorexia and all. Patient will develop pleuritic chest pain or pleurisy. If the patient is immunocompromised like diabetes mellitus or any cancer, they shows very vague clinical features. If the patient has received antimicrobial therapy, that means any antibiotics, that they also will not show more clinical features. Mainly in case of bronchopleural fistula present, patient develops chills, pleuritic chest pain, dyspnea, purulent sputum and features of lung abscess. Then this condition is, if the condition is very chronic, patient may shows clubbing of fingers. Tenderness of chest or percussion with edema of chest wall also may present. Rarely, empyema may track into the subcutaneous tissue of the chest wall and presented with localized swelling with positive cough impulse, that is called emphysema necessitans. Mainly in this condition, we can see in the picture, this empyema will be localized or tracked into the subcutaneous tissue. We can see it outside. The swelling can be seen outside and also we can see the necrosis over the subcutaneous tissue. How can we find out this empyema? Mainly by physical examination and other diagnostic measures we can find out the empyema. In case of physical examination, the patient demonstrates decreased of absent breath sounds over the affected area and there is dullness on chest percussion as well as decreased fremitus also. Patient, when we auscultate the patient, we can identify less or decreased or absent breath sounds all over the area as well as dullness on percussion. Other diagnostic measures include chest X-ray or CT scan. Usually a diagnostic thoracentesis is performed often under ultrasound guidance. Thoracentesis means insertion of needle into the pleural space and aspirating the content, and we will be send the fluid into the lab and identifying the organism. Then culture and sensitivity test of exudative fluid. And chest X-ray we can see the affected area is elevated, even the diaphragm is elevated, the white color that shows it. We can see the management aspect of empyema. The objective of the management is to drain the pleural cavity and to achieve full expansion of the lung. Drain the pleural cavity and achieve full expansion of the lung. Mainly medical management include antibiotic therapy. As we know, any inflammatory process we start antibiotic therapy. In case of lung abscess, mainly we administer penicillin or cephalosporin and aminoglycosides. The example of aminoglycoside, gentamicin and metronidazole, the antibacterial drug. Duration of the antibiotic therapy is 6 weeks. Initially we start the antibiotic therapy parenterally and it will be followed by oral route. In case of empyema develops because of tuberculosis or any extension of lung, liver abscess, it can be treated according to the disease condition. In case of tuberculosis, we start the DOTS therapy for the patient, as well as in case of liver abscess, we drain the abscess and we start the antibiotic therapy. The next management aspect is draining of the pleural fluid or purulent fluid from the thoracic cavity or pleural space. First one, it is needle aspiration. With a thin percutaneous catheter, if the fluid volume is very less, we insert a thin catheter into the pleural space and aspirate the content from the pleural space. Then second one, it is tube thoracostomy. That means water seal drainage, intercostal drainage, chest drainage using a large diameter intercostal tube attached to water seal drainage with fibrinolytic agents instilled through the chest tube in patient with loculated or complicated pleural effusions. Along with the water seal drainage, we will be adding fibrinolytic agents to decreases the purulent discharges. This is the intercostal drainage. Then third one, it is open chest drainage by thoracotomy, including potential rib resection to remove the thickened pleura, pus and debris, and to remove the underlying diseased pulmonary tissue. In this case, we may remove the rib and remove the thickened pleura, pus along with the debris. Coming to the surgical management, that is called decortication. With long-standing inflammation, an exudate can form over the lung, trapping it and interfering with its normal expansion. Decortication means we will be removing the exudate along with the pleural layers. This exudate must be removed surgically, that is the removal of this exudate is called as decortication. The drainage tube is left in place until the pus filled space is obliterated completely. After decortication, we will be keeping a drainage tube inside the pleural space till the fluid will be completely removed. The complete obliteration of the pleural space is monitored by serial chest X-rays. In case of nursing management, resolution of empyema is a prolonged process. It is a chronic illness, sometimes it may prolong. The nurse helps the patient to cope up with the condition and instruct the patient in lung expanding breathing exercise to restore normal respiratory function. Mainly, we have to teach the patient how to use the spirometry for the lung expansion and other chest physiotherapy also. The nurse also provides care specific to the method of drainage of the pleural fluid. Mainly, we have to instruct the patient or tell the patient regarding the needle aspiration, closed chest drainage or rib resection and drainage. When the patient is discharged to home with a drainage tube or system in place, the nurse instructs the patient and family on care of the drainage system, where to keep the drainage system. It should be always kept down to the chest level. Then how to care the drain site, measurement and observation of drainage. Every day we have to measure the drainage fluid. Signs and symptoms of infection, how and when to contact the healthcare provider. These are all aspects we have to teach the patient and family members. Once more we will discuss about the management aspect. Coming to the medical management, we will administer antibiotic therapy. Mainly combination of drugs can be administered, cephalosporin, aminoglycosides and metrogel. Mainly we administer. The duration of the administration 6 weeks. Initially we start this parenterally and followed by oral route. Then coming to needle aspiration. Needle aspiration, open thoracostomy, open thoracotomy. Last we can discuss of the nursing diagnosis. Ineffective breathing pattern related to accumulation of pus in the pleural space. Ineffective airway clearance related to presence of sputum in the airway. Acute pain on chest related to inflammatory process in the pleural cavity. Hyperthermia related to inflammatory process. Fatigue related to inflammatory process and fever. Activity intolerance related to decreased pulmonary function. Till now we were discussing about the definition of empyema, etiological factors, clinical features, diagnostic measures, management, mainly medical, surgical and nursing management of empyema. Last we discussed about the important nursing diagnosis that comes under empyema.